Hello everyone, good morning students. I am Anuja. I completed my medical surgical nursing post-graduation and specialized in critical care nursing. So today onwards I am planning to take medical surgical nursing classes for you people. Hope it will be helpful for you and try to utilize these classes. It will be helpful for you to understand better about medical surgical nursing. And I come across certain question papers, so I thought I'll revise or I'll solve one of the question paper today. So as the exams are coming by and it will be beneficial for you for the exams. Okay, let me start with the question paper now. Okay. So we'll start with our question paper. So the question paper is of 75 marks and is of 3 hours duration. Okay, and it consists of multiple choice questions, essays, short notes, differentiate between, give reasons, and all these things. So first of all we will deal with multiple choice questions. So first multiple choice question is inflammation of the salivary gland. Inflammation of the salivary gland is called as what? They are given the choices also here. First choice is tonsillitis. Second choice is adenoiditis. Third choice is silentinitis. And fourth choice is glossitis. So you know that what is tonsillitis. Tonsillitis is inflammation of the tonsils, right? Adenoiditis is the inflammation of the adenoids. Silentinitis is the inflammation of the salivary gland. And glossitis is inflammation of the tongue. So our answer to this question is inflammation of the salivary gland is called as what? Silentinitis. 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 Is it clear for you? Okay, good. So we'll go to the second question. Second question is absent or ineffective peristalsis of the distal esophagus accompanied by failure of the esophageal sphincter to relax in response to swallowing. It's a big question. Still you will read once again. Absent or ineffective peristalsis of the distal esophagus accompanied by failure of the esophageal sphincter to relax in response to swallowing. So this is the question and they are given 4 options also. First option is achalasia, second is GERD, third is paralytic ileus and fourth is diverticulitis. These are the 4 options for this question. So what is achalasia? We will move to achalasia first. So what is achalasia? Due to the failure of the esophageal sphincter to relax in response to swallowing, the esophagus is unable to move food to the stomach. So the answer to the question is achalasia. Achalasia is in achalasia what happens is that esophagus is unable to move food to the stomach due to the failure of the esophageal sphincter to relax in response to swallowing. So the answer for this question is achalasia. But still we'll see other also GERD. What is GERD? GERD is gastroesophageal reflux disease. Here what happens in GERD? What happens in gastroesophageal GERD, gastroesophageal reflux disease? What happens is that stomach acid or gastric acid moves back to the esophagus. Okay, moves into the esophagus. This is happening in GERD. And paralytic ileus, what happens in paralytic ileus? The muscle contraction which helps in the movement of food in the intestine is paralyzed temporarily. So the food is trapped there. So what happens if the food is trapped in the intestine? There forms the bloating, gas formation, constipation, all these things comes under paralytic ileus. And next is the diverticulitis. What is diverticulitis? Diverticulitis is the inflammation of the abnormal pouch. Abnormal pouch formed in the colon or on the bowel wall. So inflammation occurs into the abnormal small pouches which occurs in the colon or in the bowel wall. That is called as diverticulitis. So among these 4, our question is absent or ineffective peristalsis of the distal esophagus accompanied by failure of the esophageal sphincter to relax in response to swallowing. So our answer is achalasia.